Welcome back to Face the State. I'm Ariana Bennett. Thank you for staying with us. Well, suicide is a leading cause of death among Americans, and the number of people who take their own lives is steadily going up. So what is causing the increase, and how do we stop it? Misty Von Allen with Nevada Division of Public and Behavioral Health and Rochelle Pelletier with the Crisis Call Center are here to talk about that. Thank you both so much for coming on the show.
Thank you.
So a leading cause of death, like that floored me. I mean, you know that it's something that happens, but to see it put in that language to me was really striking. Does it surprise you at all?
Well, no. Since we work in this, it doesn't surprise us. You know, especially what does surprise us is the number of kids that are dying by suicide. You know, it's the third leading cause of death for children.
And when you say children, is that under 18, or are you talking like
under
young?
18?
Okay.
Yeah.
And is that number rising also?
It has risen in the last 20 years.
So we're seeing big jumps nationwide over the last few decades in the suicide rate. Why? Is there any theory why?
I think there's multiple theories, and the more research we do, the fact is we just don't have enough research. It's just not a high priority. It's a scary topic for everyone, and funding is hard to come by. But I think a big part of it is our culture is not well. We have a increasing lack of connectedness, and I think the despair thrives in isolation, and so until our communities, our families, and our culture find ways to increase that connectedness and build those bridges to help and help seeking, we're going to see these people with despair continue to struggle.
That's a really interesting observation that I hadn't really thought about, but I've read about this before where, you know, the greatest generation, so, you know, the generation that fought in World War II, for example, had a really high level of civic engagement. They joined clubs, they're part of fundraising organizations, they're very social, and then as, you know, we've gotten closer to where we are now with the, you know, younger generations, they've gotten less and less engaged with the community, and probably also coinciding with the rise of the internet. So it didn't really occur to me that that could be causing it, but it is isolating.
It is isolating, and that's exactly it, especially for young people. You know, all of us have either been at a table with other people and everyone's looking at their cell phone, especially kids. Or the other day I saw two people walking down the street side by side, both of them looking at their cell phones. So even though you'd say, oh, but we have so many friends on Facebook, actually we are getting more and more isolated every day.
But I think I want to add on to that. What's important, in Nevada, our highest rates are with our older adults. So what we have to keep in mind is suicide is never one issue, one cause. And I think the new report with the CDC has emphasized that mental health concerns are an important piece and a big piece. But we're also seeing relationships are a number one triggering event. Relationships, substance use, employment issues. And so we have to look as a community how to fix these issues. It's complex, and it needs to be a comprehensive fix.
Important to note too that you didn't just mention chronic mental health, and I think this was a fascinating part of the study, that CDC study you mentioned, that the majority of completed suicides are not from diagnosed people who are mentally, with a you know, diagnosis for a mental illness, which suggests that in many cases it might be an act of desperation, you know, that instance, but also kind of implies that this could happen to anybody. Like it's not just, you know, those people, it's the whole community is at risk, and something, you know, that we need to be paying closer attention to. Yeah. I think part of the reason I wanted to bring this up for this episode is the recent, you know, high profile suicides of Anthony Bourdain and Kate Spade, and we see, you know, outpouring of sadness anytime a celebrity dies on social media, but for this one it was particularly poignant, I think, for a lot of people, and I was wondering if seeing that is kind of a trigger for people who are already hurting. Is that something that you think is possible?
Well, it is a trigger, but it also makes people think about it. If, you know, they think that a celebrity has everything going in their favor, you know, and it helps to see that someone else, doesn't matter how successful, it doesn't matter what they've got going on or what it looks like on the outside. On the inside, they may have a lot of other issues going on that get them to this point that they're in so much pain that this feels like their only option.
I think it also demonstrates what an important partner the media plays in this, because they can give us the resources for support, really connect to how recovery and hope can still happen with a mental health issue, a mental health crisis, or even after an attempt with suicide. Most people go on to live satisfying lives in recovery.
Right, that's exactly right. You know, the important part here is that it's preventable. This is something
Absolutely.
that, you know, is actionable, and everyone has a role to play, you know, starting with being able to identify when someone might be at risk. So what are the risk factors that we should be looking for in our friends, loved ones, colleagues?
Change in behaviors are a key. Whether they are taking risks that they wouldn't have taken before. What are some other ones that?
Any change, I like to say, because we are so unique, and culture and gender and age come with so many different risk factors. I think any change in mood, behavior, appearance are worth taking note. And we train about 15,000 people across the state every year. When we see these high-profile suicide deaths or others on social media, we often say, reach out for the hotline, you know, reach out and call and ask for help, which is really important. It's such a great service. But when you're in that depth of despair and darkness, often the person doesn't have the strength to reach out or the hope that that will help. So we really help teach friends and family they need to be the one reaching out, recognizing those changes, and helping them have that conversation about their pain. Really important.
So what's the right way to broach that subject? That's not an easy thing to do.
Make sure that what we say is just ask about it very specifically. I've seen this change, and I'd really like to talk to you about it. And then ask about suicide very directly in a non-judgmental way. Are you thinking about killing yourself? Are you thinking about hurting yourself?
So that direct.
Very direct to them. What we found, people are so scared to ask that question, but it's one of the most important questions you can ask. It's one of the first questions we ask when you call into us. Because what usually happens is the person who's calling feels such relief, or the person you're talking to feels such relief that someone asked them that. Because they've got all sorts of things going on inside. They probably feel guilty that they're even having these thoughts. They really, in the crisis moment, feel like both that's the only way they can get rid of the pain, but that their loved ones would be better off without them. They wouldn't have to deal with this, with their problems anymore. And as we know, sitting here talking about it, that couldn't be further from the truth. So just asking that question usually really gives a lot of relief to the person who's feeling that way.
Okay, and then from there, where do you take the conversation? Is it, you know, referral to a resource, or what's the next step?
Usually what I find is it's being an advocate for that person. You know, we don't think about it. It's not just giving them, you know, the crisis call center or Lifeline's phone number. It's being an advocate, saying you understand, you care about them. Let's see what we can do to get you help. For the moment, you know, let's call the crisis call center and get some help, but also help them find, you know, maybe a therapist or a doctor. Follow up with them to make sure they're doing okay, you know, after tomorrow or the next day or in the coming weeks. Also, make sure you get rid of any kind of lethal means, you know, that are in the house with them, or ask them about it. What are they thinking, you know, how are they thinking about doing this? You know, and help them to get rid of the lethal means.
Yeah, and I know across the country, the majority of suicides are done using firearms. So locking up the firearms, and then also securing prescription medication is the other big one.
We've reduced our firearm suicide deaths from 57% to 51% by getting out there and working with gun shops and at gun shows and sharing that this is an injury prevention opportunity, and I do think it is impacting our rates overall as a state.
Yeah, and that's important because Nevada, has had really high rates. Where do we stand now?
We're 5th in the nation, 5th highest rates. We were out of the top 10 for 1 year, and now I think we're still very high, and the rest of the nation is starting to catch up with our high rates, unfortunately.
Okay, so what other resources are available? I mean, obviously we have the hotline that people can always call, but is there counseling help that's available through the state, or anything that people can look for?
I think some really important resources that are really excellent. The MOST team, the mobile outreach, is something anyone can call, as well as the mobile crisis response teams for 18 years of age and under. Excellent resources to connect them to assessments and maybe some stabilization for the families.
Okay. Well, we have about a minute left. So is there anything in particular that you really want people to know? Maybe they're hurting or they're worried about a loved one?
Reach out. Call us. Call the Crisis Call Center. I know you're putting that number up. That is a nationwide phone number, so everything for Nevada comes to us first, and then if we're busy, it'll roll out to another crisis center in the United States so that they can get help immediately. Call and get that help.
And I would add, for friends and loved ones, if you see any change, it's worth exploring. And so you can also call the hotline, or you can call the Office of Suicide Prevention and get guidance in how to connect that person you're worried about to the resources they need.
Okay, and of course we'll be putting all those resources up on our website as well. If people need to get access to that, always call the hotline. We have that number up on your screen right now. Thank you both so much for your time. I sure appreciate it. And
thank you for the
work
opportunity.
you do. All right, well, that is it for this episode of Face the State. But for more information on all of this, or to see past episodes, you can just head to our website. That's ktvn.com. Thank you so much for being with us. We'll see you next week.